A warm welcome to all. Today we will be dealing with the topic provisional restorations in fixed partial denture. Introduction: it is important that the prepared tooth or teeth be protected and the patient be kept comfortable while the cast restoration is being fabricated. The provisional restoration is also called temporary, interim, transitional restorations. It is defined according to the GPT-9 as a fixed dental process designed to enhance aesthetics, stabilization and or function for a limited period of time, after which it is to be replaced by a definitive dental prosthesis. So various requirements are there, like biologic, mechanical and aesthetic. The biological one includes the pulpal protection, periodontal health, positional stability or occlusal compatibility and prevention of fracture. The mechanical one includes function, close adaptation to prevent displacement and removal for reuse. Removal for reuse in the sense we have to remove the temporary crowns while we go for a metal trial or a disc trial. So after that, we will be re-cementing it back. That is a removal for reuse. The biological one, basically the pulpal protection. The restoration must be fabricated of a material that will prevent conduction of extreme temperatures, microbiological infection, chemical and mechanical injuries. And it has to maintain periodontal health. The periodontal health has to be maintained by the proper extent of margins and the proper contour. As you can see in the figure, the rag margin, it attracts the plaque and can cause periodontal issues. Occlusal compatibility, proper occlusal and proximal contacts promote patient comfort and maintain the tooth position. Like that, the maintenance of the tooth position has to be done with help of a provisional restorations. Okay. Protect against fracture. The protection against fracture, in the sense, it should have adequate strength to withstand against the masticatory forces to prevent the fracture of the underlying tooth structure. The aesthetic part, it should be easily controllable. There should be color compatibility and there should be translucency and color stability. So coming onto the types, it includes the direct, indirect, and indirect techniques. That is based on the techniques of fabrication. Then it can also be classified into prefabricated and custom restorations. So just going into prefabricated restoration, custom made restorations. The prefabricated ones, it includes the anatomical metal crown forms, clear celluloid shells, and tooth-colored polycarbonate crown forms. The custom-made restoration includes the custom crowns and fixed partial dentures that can be fabricated of several different kinds of resins by a variety of methods, basically the direct and indirect methods. Now, coming to the materials, the prefabricated ones, which is basically of the metal and resins. Metal, basically anatomical metal crown forms, tin silver, nickel-chromium, stock aluminum cylinders, while the resin includes the cellulose acetate and tooth-colored polycarbonate crown forms. For the custom-made, the material are basically acrylics. Acrylics includes the polymethyl methacrylate and polyacrylics. Then bisacryl composites also. Then coming to the major area, that is based on the technique of fabrication, it is the direct, indirect, and indirect. So direct means it is basically done on the patient's mouth, and indirect means it is done on a cast. So the polycarbonate crowns in direct techniques. So here we will measure the after tooth preparation. We will measure the mesiodistal width of the crown. After measuring the mesiodistal width, we will select the appropriate size and shade of the crown form that is being available, and its length is been checked. And if there is any excess length in the cervical area, we mark that area and we will remove the excess length. We will check the fit and size again. After confirming it, we will apply some polymethyl methacrylate into the shell and then place it in the patient's mouth after application of petroleum gel. So after application of the Vaseline or petroleum gel, this crown is being seated, and after when it starts to set slightly, we will rock it facially and then remove it and place it in the warm water for the material to set. After it is set, we will remove the excess. We will cement it with a temporary luting cement. Mostly it's a single set usually. Then coming on to the direct technique using an index. So as you can see in the figure, consider it to be an oral cavity. So when a tooth is missing, in that area we will be placing an artificial tooth. We will be securing it with help of composite to maintain its position. We will take the putty index, we will keep it aside. Then we will do the tooth preparation. Then after doing the tooth preparation, we will place the putty index back in the prepared tooth area. We will apply some pressure We'll remove the putty index. We'll take out the provisional restoration. We'll remove the excess. Then we will cement it with the. We will after polishing we will cement it with the luting cements. So this is another scenario where an RPD for the patient is present for the replacing the missing tooth. Here the RPD with the RPD putty index is being taken. The excess denture base is then trimmed off. The putty index is kept aside. We will do the tooth preparation. After doing the tooth preparation, we'll apply the polymethyl methacrylate into the putty index. We'll seat it in the patient's mouth after the application of the petroleum gel or Vaseline, and then we will remove it. Then we will remove the provisional restoration from the oral cavity or from the putty index. We will remove the excess, finish it, polish it, and then we will cement it in the patient's mouth with the help of a temporary luting cement. That is with the direct techniques. Then coming on to the indirect techniques. So the first one is a preformed nickel-chromium crowns. As you can see, it is done in a cast. So the appropriate size is being selected. It is then applied to the tooth surface with the help of some pliers to get a proper contour and adaptation. And the excess, if there is a percent, is cut off with the scissors from the cervical region. After proper adaptation, it is then seated in the cast. We check for the occlusion. After checking the occlusion and confirming, we will cement it in the patient's mouth. Now coming on to the indirect technique using index. So in this you can see there is use of a diagnostic cast. The second figure shows the diagnostic cast. We will place an artificial tooth. We will take the putty index. We will keep it aside. We will do the tooth preparation. We will make the impression. After making the impression and pouring the cast, we will apply the putty index with the acrylic onto the cast after application of separating medium. Then we will remove it. Then we will remove the excess. We will try it in the patient's mouth and we will cement it. Now indirect technique using a template. Here instead of going with the putty index, we are using a template. So in the diagnostic cast, we will place the artificial tooth. We will place the artificial tooth, then adapt the thermoplastic material or the resin material over it. We will make up the template and we will keep it aside. We will do the tooth preparation. We will make the impression. After making the impression and pouring cast, we will just check for the fit for the template. If it is properly fitting, then we will apply the polymethyl methacrylate into the template and we will place it in the cast. And we can place it in the pressure bath for some 5 minutes. And after it is set, we will remove the template. We will take out the provisional restoration. We will trim the excess, polish it, and we will cement. Now coming to the last technique, that is a direct indirect technique. So in direct indirect technique, we will be making a from the diagnostic cast, we will be making a template. Okay. After making the template, we will be doing a mock tooth preparation in the diagnostic cast. After doing the mock preparation, we will adapt the template with help and after application of separating medium and application of the polymethyl methacrylate into the template, we will be placing it over the cast that is being prepared. Then once we take that provisional template made provisional restoration, we will try it in the patient's mouth after tooth preparation. So here there is no extra impression that is being taken for the patient for fabrication of a provisional restoration. So directly in the patient, in the first step, it is indirect. That is over the cast, we will be doing a mouth preparation and we will be fabricating a shell, provisional restoration shell. And this shell is being directly then tried in the patient. And if it is loosely fitting or it is simply going inside, then we can apply a little bit of acrylic on the inside surface and then we can apply some petroleum jelly and place it in the seat in the patient mouth. We will remove and after that we will rock it buccolingually and take it out. Then we will remove the excess and then again we will cement it with a luting cement. Okay. That's the end of the discussion today. I hope you guys understood. Thank you.